So, hello viewers. This special edition of Cypher Health News is being released on the World Immunization Week with the theme Vaccines Bring Us Closer. World Immunization Week 2021, 24th to 30th April will show how vaccination connects us to the people, goals, and moments that matter to us most, helping improve the health of everyone, everywhere throughout the life. So I'm Dr. Rakesh Gupta, President and Director of Public Health Strategic Institute for Public Health Education Research. And I have with me Dr. Sonu Goel, is Professor in Department of Community Medicine and School of Public Health, PJIMR, Chandigarh. So dear viewers, we welcome you all to this very special edition of Cypher Health News channel, coinciding with the World Immunization Week. It is my proud privilege to introduce Madam Vinnie Mahajan. So, Ma'am Vinnie Mahajan, she is Chief Secretary to the Government of Punjab, and she is a 1987 batch IS officer. She is currently Chief Secretary to the Government of Punjab since June 2020, and she is also Principal Secretary, Department of Personnel and Vigilance. She is an economics graduate from Lady Shri Ram College, Delhi University, and an MBA from Indian Institute of Management, Calcutta, where she earned a place on the Roll of Honor. She had many academic honors, including Rector's Prize of Delhi University, Finance Scholarship, and Shri Ram Smarak Nidhi Scholarship, IIM Calcutta. Kumari Reena Sandhu, Gold Medal for Best in Curricular Activities of Lal Bahadur Shastri, National Academy of Administration, Mussoorie.
About her family, her husband is Mr. Dinkar Gupta, who is currently serving as IPS in he's DGP in Punjab, and her father Shri Bibi Mahajan was also an IAS officer of Punjab cadre, 1957 batch topper. And talking about her career, Ms. Mahajan served in the office of then Prime Minister Shri Manmohan Singh from 2005 to 2012, and handled matters related to finance, industry, commerce, telecom, IT. She's only Punjab cadre officer currently in the state who's empaneled to hold a secretarial position with the central government. And she has been so far the additional chief secretary, health and family welfare, investment promotion, industry and commerce, IT, governance reforms, and public grievances. She has been playing a crucial role in steering the Punjab government's response to the COVID crisis as chairperson of health sector response and procurement committee.
So earlier important appointments, she was the first women Deputy Commissioner, Roopnagar, July 1995. And she also remained MD of the Punjab Infrastructure Development Board with effect from July 2001. She was Member Secretary Advisory Committee on Fiscal Reforms and Financial Reconstruction and Resource Mobilization, Government of Punjab. And she was also Managing Director of Punjab Tourism Development Corporation Limited from July 97 to July 2000. And her professional awards, she received Satyan Matra Memorial National Literacy Award on behalf of Ropar District for the best performance in the country. And she also had a national prize for outstanding achievement in popularizing Mahila Samriddhi Yojana, a scheme with women's empowerment and encouragement of the savings habit as its twin objectives.
She has a lot of achievements as Principal Secretary, Health and Family Welfare and ACS Health. Some of them include the Punjab was adjunct as the best performing states in all national health programs during her tenure, and Punjab government prohibited manufacture and sale of e-cigarettes in 2013. It was well before the government of India banned them in 2019. Under her tenure, Punjab got the WHO World No Tobacco Day Award in 2015, and she also conducted the Punjab Health Summit in 2016, and she was instrumental in setting up the Center of Excellence in Autism. Besides many fellowships and honors, she was awarded the Hubert Humphrey prestigious fellowship by the United States Department of the States.
I'd like to ask you to release our Cypher annual report, ma'am. It will just take a second. So, ma'am, this is the CIPHER annual report for 2020-21. And Dr. Sonu, can you tell about the glimpses of the activities?
Yeah, just ma'am. I think we had this cipher was established in 2018, and now it is around 3 years since it has been working. So we are working in the advocacy primarily, and a lot many meetings in tobacco control in the area of eye health and various public health issues were conducted. So these were some of the glimpses of them. So one, we did a national consultation on human rights dimensions of tobacco control. So Madam Preeti Sudan was the chief guest at that during the consultation, and many luminaries like Madam Meera Aghi and many people were there. So we also conducted virtual dissemination workshop for hypertension and trans fat. Our health minister, Shri Balbir Singh Sidhuji, was the chief guest of that occasion. And then also we conducted a national consultation of women in tobacco. So these were some of the activities which we conducted, ma'am, during last year. Yes.
So, ma'am, we'll just like to know that since you have been appreciated for your proactive approach on health issues, focusing on public health. So, can you let us know about some of your achievements in the health sector when you headed the health department first as Principal Secretary Health and then as ACS Health?
Thank you. First of all, my compliments to Dr. Rakesh and to Dr. Sonu Goyal. You are and have been doing wonderful work. In particular, your work on advocacy of public health interventions is something that I've seen over the years and greatly appreciate. So congratulations, and congratulations also for the series of activities that you have carried out and that have been listed out in the document. So well done, keep it up, and I hope many others similarly placed and well, you know, with the same kind of positive thinking on health issues will team up with you. In terms of what Punjab prioritized or achieved, so as you know, Punjab is a state of very dynamic people doing very well on a lot of parameters, but its health parameters were something that we were not entirely proud of. In particular, the fact that people seem to have lost a little bit of faith in the government system and going more and more to the private healthcare. And private healthcare is, as again we know, of covers the whole spectrum. There are excellent, well-meaning, well-functioning hospitals and doctors in the private sector. There are also the what we call the RMPs, the untrained, and more importantly, people who tend to over diagnose, over treat, leading to issues of antimicrobial resistance, heavy use of steroids, all of those things. So there does, given that there are very serious asymmetries of information in healthcare, we all understand that if a doctor prescribes a particular test, really it's only another specialist doctor who can decide, and sometimes not even they, on whether that test is required for the patient or required for the diagnostic lab to make some money on, etc. Whether some even procedure, whether the procedure was actually needed or not, and whether the medication that's prescribed is the correct medication, whether there would be cheaper generic versions that would be equally good, and so on and so forth. So in view of this, which is generally called issues of asymmetry of information, it is particularly important in healthcare to have a vibrant government public healthcare system, which can act as, in a sense, checks and balances to rapacious private healthcare. And I again want to emphasize, not the entire private sector is problematic, but there is some. And people must have a choice on where they wish to go, but in particular, there must be a strong, well-functioning public healthcare system. So one of the things that we tried to diagnose was how can we get people to the public healthcare system? And one of the things we learned early on was that while our doctors are very good, our equipment is on the whole good, people do want the medicines also to be available in hospitals, and those were not becoming available. One of the first things that we did in 2012 was to introduce the concept of free essential drugs in the NHM portfolio, and through that to make them available in each and every hospital. It was not easy. There were so many instances when on a tour, on a visit of a hospital, I would still find by the bedside of the patient that typical chemist the bag of medicines from clearly from the neighborhood chemist. And I would ask, why did this patient need to get this? And that would often, that bag would have syringes or basic things that were part of our essential drug list and should have been made available free of cost. So I think the entire health system of Punjab worked very hard and very effectively to make sure, for example, for pregnant women, the entire there was a lot of importance given to that. So free essential drugs, free consumables, free treatment for the entire duration of the pregnancy, going up to the JSSK sort of antenatal and other newborn care. These were some of the basic things that we focused on. Of course, there were many other interventions that were needed, whether it was for the girl child, whether it was for issues of non-communicable diseases, such as tobacco, where you all were majorly partners, and the state did a wonderful job of bringing in awareness and action on ground. There were issues around cancer, around hepatitis C. So I think we tried to capture a range of issues from the availability and of treatment and the leading to confidence of people in the government health sector, to addressing issues around NCDs, to issues around awareness, bringing in the concept of health and wellness in some ways. There were, projects, pilots taking place all over on various kind of efforts. And I think the entire health machinery was robust, responsive, and we saw a lot of forward movement on various parameters, which also resulted in Punjab receiving national recognition.
Yeah, and even international recognition, ma'am. You are known internationally for, especially for that tobacco control work. Ma'am, you touched upon that idea of public-private partnership during your interaction with ISP students. So can you just say something about it, also PPP more?
Yeah, I think we all understand that India follows a mixed economy. So while we have strong public systems, and especially in areas like healthcare, I have just dwelt at some length, they are very important. We also have strong private healthcare, and a lot of people go there. But there is a whole area where the public and the private sectors can work together and become force multipliers in some ways. And those are the kind of opportunities we have tried to see. There are all kinds of options available. For example, we have the very successful intervention where land was offered in Mohali at the surplus land of the civil hospital. And we have an excellent facility that is now available to the people, not just of Punjab, but there are actually people coming from the entire hinterland, from Haryana up to Delhi, etc., to avail these services. Similarly, we tried to put up diagnostic services, other services. One successful example again has been the ambulance service, where the state government procures the ambulance, but it is operated through a call center run by a private partner, and they are obliged to make sure certain outcomes are achieved in the sense of ambulance reaching the needy person within a defined time frame. The call center has to be operational, the ambulance has to have the required manpower and whatever other amenities are prescribed. So the entire 108 ambulance service in Punjab has been run very successfully on PPP mode. The 104 helpline, the medical helpline. So again, it used to be a big issue. People would call up, try and find out the mobile number of officers, and officers reach through to them with their problems. But once we had a call center operating, that call center could conveniently receive people's questions, complaints, grievances, etc., and handle them professionally. And that was also done through a PPP. So there are successful examples of public-private partnerships. And I think the government must always remain alert to the opportunities of bringing in the private sector, while making sure that it retains control over the outcomes. It is able to regulate the working of the private sector, and it is able to ensure that the outcomes that are desired for the people of the state are actually achieved.
Thank you, ma'am. And I'll also like to mention about the CMEs. Actually, I mean, there were a series of CMEs during your time in different specializations. That was a big success.
That was a public-public partnership. That was a partnership that Dr. K.K. Talwar, who was our advisor on health and medical education, was able to bring in partnership with PGI in particular. And it was such an honor and a privilege that the heads of departments, supported by senior faculty from PGI, would come on Sunday without any complaint or any asking for any money, and they would willingly give their entire Sunday for training our specialists. And we would every Sunday some specialty or the other. And I think our specialist doctors, particularly those in the hinterland, who do suffer from not having other experts around to discuss difficult cases, to stay abreast of the latest developments, they gained hugely through these weekly CMEs.
And that corneal blindness backlog free initiative, that was an excellent, that was in fact a public-private partnership, you can say, because all private eye banks were with us.
That is right.
Yeah. So Dr. Sonu, you can ask some question.
Yes, ma'am. I was also a witness about your exemplary work in health sector, because PGI has been quietly closely collaborating with Government of Punjab. And without hesitation, I would like to ask you about like something which we need to do on tobacco control, especially I was working on it. And we did a lot of, I think, work under your mentorship at that point of time. And the Punjab government got the WHO No Tobacco Day Award. And it was one of the first state actually, which was the tobacco-free state, bigger state, although Sikkim was the first state, but it was the first bigger state which did it. So ma'am, just want to know right now, like everybody is, there is a one word which is in everybody's mouth, that is Corona. So ma'am, state of Punjab, despite facing numerous challenges in COVID pandemic, but I think it has been doing quite well in terms of mitigating that pandemic. And the strategy, since you have worked very intensely, you are working, have worked and working very intensively in containing the COVID pandemic. So what has been, because you are a management graduate also, and I think you are using all those management principles in containing that pandemic. So can you highlight some of them to our viewers?
COVID was a challenge for all of us because of its newness, and because in the early days, especially, nobody knew what were the ways of precise ways of spread and how to control the spread, how to limit it, and how to take care of the sick. In fact, in the beginning, we didn't even know whether it was mostly through contact. We were constantly afraid of touching surfaces, etc. And over the course of time, we learned that it is largely airborne. And what is most important is, apart, of course, from wearing masks, is to be in open or well-ventilated spaces. So the learning developed. I think one of the things we were fortunate in the state was to have a solid medical advice available to us. Again, with Dr. Talwar, with PGI, there were faculty from abroad. Every week there would be a video conference sessions where specialists from the whole hinterland would get together, talk to experts. So in one group, there would be almost 200, sometimes more persons. And there would be people from New York and people from Fazilka talking to each other, discussing all the issues around COVID management. We also had the support of all agencies of the state government. So all of government pulled together, whether they were offices or departments. And it was possible, therefore, to do things like containment to make sure that we control the spread. Punjab has historically a strong global presence, and that movement to and fro did also contribute a little bit to the higher spread in the state, starting from the early days to the fact that currently over 85% of the virus that has been genome sequenced in the state in the recent episodes of February and March have been of the UK strain. And we know that that strain is more virulent, spreads faster, and so on. Our approach has been to try and make sure that we minimize the economic consequences of our actions by minimizing lockdowns, by minimizing the stoppage of economic activity in the form of working of industry, etc. Even as we identified where we needed to stop activity, because if lives have to be saved, some hurt, even if it's necessary, has to be, some pain needs to be inflicted. So with the understanding that it is gatherings, especially indoor gatherings, especially gatherings which necessarily involve that there will be COVID inappropriate behavior or absence of COVID appropriate behavior, that is what we targeted. So the number of people coming to weddings, for example, weddings are typically difficult events. People come together, don't wear masks, are together for a long time, often in closed spaces. So those restrictions were put in place on restaurants. So we've tried to make sure that we do a targeted stoppage of activities as and when the situation demanded it, and minimize the adverse consequences on the economy. We also worked on making sure that our health system was fully in readiness. With the support of experts, we were one of the first states to understand the importance of high flow nasal cannulas, for example, versus ventilators. So at a time when even Government of India, I may say, was actually procuring ventilators, we were focusing on HFNCs, which actually proved over time to be a much more important instrument for saving lives in COVID. So we got our equipment, we got our drugs in place, we got our protocols in place, and most importantly, we had the partnerships where the treating faculty, treating doctors could get together, discuss, and take the correct decisions. And we believe that those have been helpful to the people of Punjab. Our total COVID cases, when you compare with other states in the country, we have never gone above 17th position. We are happy to be at the bottom of the list insofar as positive COVID cases is concerned. And we will keep working together because we are still, this is our second wave. We know that some states are seeing their fourth wave, and many states are seeing very, very difficult situation. So when the whole country faces a problem, then we also naturally are going to get affected. Our regular sources of oxygen are being diverted to other states with more serious requirements. There are medicines which are flowing to other states with more desperate requirements. So we are working on all these things. And again, what we are trying to do is work in partnership so that our private healthcare sector also is strengthened, enabled. While we keep a very strong check, we have had our expert teams. At the time when the problem was at its minimum, we used that time to review which hospitals were doing well, which hospitals had not been able to provide the correct level of services. And we have highlighted that these are the well-functioning hospitals, and we have informed the not so well-performing ones to improve on parameters that we guided them on. But we are now, when they are facing problems of oxygen, drugs, etc., we are assuring them that we are with them, we will back them up, support them, so that both the government and the private sector works together to provide the people of the state with the best care. Not just people of the state, people from other states are coming in. Just today, some deputy commissioners asked me that people are coming from other states, what should we do? And I told them that while we do want to give priority to our own people, as a policy, the state of Punjab has never said no to a patient. The patient may be from anywhere, but if that patient needs medical care, if we can give it, we will give it. So we are trying to make the best possible care available to everybody.
Really encompassed all the principles, whether it is teamwork, collaboration, effective communication, partnerships, and overall the leadership which you have demonstrated from the front. And I think these are all the things which I think the management students would like to learn about to go, how to take care of their own people. And ma'am, just to another question about our international management program. So you have been honored guest for many of our international programs, management and leadership programs, which we have been conducting since 2016. And under this Indian Technical Economic Cooperation by Ministry of External Affairs. And till date, we have trained around 550 senior professionals from 75 countries in last 4 years. And considering the demand, we have now introduced an online course now because the situation demanded that there are many more people who wanted to come. But so we are from next month, we are introducing that online courses. So ma'am, just your message to young budding public health specialists and the participants of such programs which want to learn the management.
I think, Dr. Goyal, you have done a wonderful job in putting together this program. It is a strength of our country that we have very well-functioning institutions available. And it is our privilege to be putting together such programs for participants from other countries to learn from us, but also to learn from each other. And so these programs in which people come together from all over the world, especially from the African countries, I believe and I have experienced that they have been very successful, and people have really valued being participants here. I think it is extremely important for each of us to expand our learning, and therefore lifetime learning is something which each one of us needs to aim for. But more importantly for health professionals, because there are so many new approaches, new interventions, new even techniques and products that are coming in, that it is very helpful for people to get together and understand. But the key, we all, and we know that much more than curative, the public health part of healthcare is really important. We have to get the right messages across to people, because often people can make or mar their own health by, for example, use of tobacco, or not using tobacco. They can make themselves and they can make their families um, less or more healthy. So we need to make sure that public health aspects of healthcare are duly emphasized. And I think programs like this, which bring together these professionals, and they also understand the various tools that can be used for improving the healthcare of the communities that they are in or they are serving. Those are really important, and I think game-changing kind of learnings. And I wish the program and its participants every success.
And ma'am, we'll like to put, because this time we like to put such talks with alumni like you in those programs, so that they can also learn some of the things which are really practical and from the mouth of experts, like how, because teaching is different and the learning from experts from their own mouth, I think that is really important.
Certainly.
So we'll
Dr.
be
Ashish.
using all this, ma'am, all these informal talks by people like you. And
Thank
so I think the participants will benefit. But there was one question in my mind. I was just listening to Director Ames, Dr. Guleria, and there's a WHO report also regarding remdesivir, that it may not be very useful, and people are actually panicky when they don't get it. So will you, issue an advisory or something like that after consultation with the public health specialist?
I think
I
I think all of us who are engaged in COVID care, and in particular the professionals treating doctors, are well aware of the uses and limitations of various drugs, including remdesivir. Also, tocilizumab has been very much in the news.
Yeah, yeah.
And you know that earlier there was a big buzz around convalescent plasma therapy, for example.
Yeah, yeah,
In Punjab, we have used all these. We have seen their scientifically assessed them, and we have also been guided by studies such as the WHO supported solidarity trials. I think everybody who has any interest and understanding knows, for example, that the antiviral remdesivir is not something which is life-saving, in the sense that it is not useful in critically ill COVID patients. But a lot of treating doctors do believe that if given at very early stages to people who need some oxygen support but are not desperately sick, it tends to reduce the recovery time. And that is about all. So there is no reason why it should become a drug that there is so much panic about and black market over. Even tocilizumab has its uses and its limitations. It is not, there is no miracle drug. I try to tell people that if there had been a miracle drug which would have saved COVID patients' lives just by taking that drug, why would the US and why would Europe and all those countries which are the sources of those drugs and have the means and have those drugs, why would people be losing their lives there and in much larger numbers than here? So this is something that all of us together have to educate the people. It is the treating doctors, it is also other public health and professionals, the media. Everybody has a responsibility to guide people correctly, because in a panic they do these mistakes. And this is just an example. There are so many other things like this where people do not really know the truth, or the truth is not properly made available to them, and they get taken in by either quacks or some people with vested interests, or just misinformation in this age of social media. There is so much misinformation that there is an adverse effect on their own health and their families and communities' health. So great role, therefore, for all of people like you who are professionals and who are in this space to do as much IEC as possible, use social media. We all need to work together for this.
So thank you, ma'am, and thank you for a wonderful interaction. And I'm
Thank you.
sure our public health specialists and the juniors who are getting into the public health, so they'll benefit a lot. So thank you. And
Thank you.
thank you, viewers.
Thank you.
And thank you,
Thank you
viewers.
very much, ma'am.
Yeah. And now we'll have news from Doc Plexus, the health news. Thank you.
Hello and welcome to the Health Minute Highlights. The National Medical Commission has advised all the health science universities to conduct theory exams for MBBS students only in offline mode, taking all the necessary precautions. The advisory added that students who cannot appear for the exams can take it along with the supplementary batches and that it will not be counted as an additional attempt. The Health Ministry has announced that all the existing claims under the Pradhan Mantri Garib Kalyan package will be settled by today, after which new dispensation will be provided to COVID-19 warriors. This step is to ensure that the families of healthcare workers are taken care of in case of any adversity due to COVID-19.
The US FDA has given priority review and orphan drug designation to nivolumab for the treatment of advanced or metastatic gastric cancer, esophageal adenocarcinoma, and gastroesophageal junction cancer in combination with certain types of chemotherapy. This drug is a monoclonal antibody that promotes T-cell function, thereby inhibiting tumor growth.
A research finding from the Texas Tech University describes the role of specific genes in wound healing. Patient genetics determine the microbial diversity in wounds, with a more diverse wound microbiome taking lesser time to heal. Genomic predictive modeling was used for identifying the genetic variations that influence host microbiome interaction and wound infection pathogenesis, a step towards personalized medicine. Health Minute, the most liked segment of Doc Plexus, brings you the latest happenings in the medical field. Stay tuned for more insights. Happy Doc Plexing!